Hello, I'm Dr. John Preston Perry. I am a board certified reproductive endocrinology and infertility specialist, and welcome to my YouTube channel. And there are all kinds of things that people blur together, which are in very different categories, and we need to talk about ovarian cysts. So, if you're interested in this, you have them, you know people who have them, and want to learn more, this is the video for you. What is an ovarian cyst? A cyst is really a fluid collection in the ovary that is bigger than it's supposed to be. Now, and usually people talk above 3 centimeters or 4 centimeters, and certainly if you're above 10 centimeters, that's very concerning. Or not very concerning, but it depends on the circumstances. There's a lot that goes into it. I want to distinguish ovarian cysts from polycystic ovarian syndrome. Polycystic ovarian syndrome needs a new name because when you talk a cyst that's 3 centimeters, that's not what you're getting with PCOS. PCOS or polycystic ovarian syndrome usually is having a lot of really small follicles, generally under 10 millimeters, but especially under 5, and you'll have 40 of them. And what it really reflects is an overabundance of eggs that have made it to a particular point, and that's very different implications from cysts. PCOS, you say, oh, you have it. You don't necessarily do monitoring for that, with rare exception. For cysts, it depends a lot on, what the cyst looks like. So there are things in how it looks. Are they on one side? Are they on both sides? Is there fluid in the abdomen called ascites? That's where when you start seeing ascites and there's large volume, you start worrying for ovarian cancer. You say, okay, how big is it? Is it solid? Is there a septum? Is there a sort of division in the cyst partially? There are all kinds of little things you can look at. There are a couple core types of cysts that people look at. One is simple or follicular cysts. Most women get that every month. Another is a dermoid cyst. Dermoid cysts are cysts where they have all kinds of potential to grow into things. So remember, the egg can grow into a baby, so all kinds of tissues, once fertilized. Dermoids grow into all kinds of tissues, and you can find that these cysts in the ovary can actually have teeth and hair, and they have really interesting, weird appearances on ultrasound. Those are rare, but you can find them. Another thing is an endometrioma. That is a inflammatory state of the pelvis where most people believe that it's from retrograde menstruation. So menses, as it comes out vaginally, it goes back through the tubes, and these cells can implant where you ovulated from, then get walled off, and they just grow these cysts within that walled off area. Those can be very painful and cause a lot of scarring. And then people talk about cystadenomas, which is a whole category in and of itself. I almost never see these. Most of what I get is normal. Let's ovulate. This is the time of the month. I get my share of PCOS, which is technically not cysts, the way I like to think about them. You can get follicular cysts. Again, boy, you thought you were going to ovulate, but somehow things got walled off and then the cyst got really big. But usually this is a solid black. Usually it's under 5 centimeters in size, and usually it goes away fairly quickly. Dermoid cysts don't usually go away. Endometriomas don't often go away. And those are ones that can last for years and years on end. And especially if they have pain or they rupture, they can cause a bit of problems. And so you want to understand what you've got. One thing people ask is, do I know if I've got an ovarian cyst? So first, remember at the mid-luteal phase, two-thirds, three-quarters of the way through your cycle, everyone has a cyst, from where they ovulated from. But you're really looking for, again, larger cysts, concerning cysts, for things like that. And again, if you have cysts postmenopausally, that's a completely different thing from premenopausally. Bottom line, a lot of women have them. They don't know about them. They go away on their own. Sometimes people can have tenderness, particularly with endometriomas or dermoids, where they're just inflammatory and irritating an area. But again, you can see those where people have no symptoms as well. You can also have people with no symptoms for large simple cysts. You can have people with symptoms thinking they have a cyst and they don't. So it's really hard to predict, and ultrasound's a much more reliable way of following where they are than necessarily just trying to feel it or to, uh, you know, get just your own opinion for things. Get checked out if you're worried or wondering on something. The next thing is, can ovarian cysts prevent pregnancy? Usually not. In fact, there are a lot of times, and again, endometriomas, they can scar tubes, they can cause all kinds of problems, and that's bad for pregnancy. They can inflame the ovary, lower quality eggs, that's bad for pregnancy. PCOS, if you don't ovulate, it's hard to get pregnant. But for the most part, ovarian cysts don't prevent pregnancy. Now, sometimes they're hormonally active. If they secrete progesterone, they can block ovulation of other eggs, or they secrete estrogen can do that. But for the most part, you can even power through a lot of them, but it depends on circumstances. Talk to an OBGYN. Can an ovarian cyst hide a pregnancy? I can't remember the last time it did for me. Certainly, you can have a sonographer or someone who gets a little bit confused, but usually you can see the uterus fairly well, whether there's a cyst or not. Also, you can have ectopic pregnancies, and someone says, "Oh, there should be something in the uterus, we don't see it." And then they found the cyst, and the cyst was actually the pregnancy. Most of the time, you should figure that out, but there's some rare exceptions. So certainly go to a clinician that you trust for things. How do you know if a cyst is affecting your fertility? Most of the time, it won't. But at the same time, especially the larger they get, the more you need to look into them. The other thing is when you're taking care of a cyst, if it's large, it's been there a while, and you try to remove it, you can actually take away some of the blood supply and lower the egg count on that side. So some people also explore drainage, even though drainage most of the time doesn't work, or around 50% in some studies. But cyst drainage may not get you where you want to be, but it doesn't devascularize the ovary or take away its blood supply, so you aren't losing eggs. So that's why some people turn to a lower aggressiveness approach before they go for all-out surgery and possibly removing some of their reserve. Can you get pregnant with ovarian cysts? Well, you had to ovulate to get pregnant, and there will be a corpus luteum that secretes progesterone that maintains the pregnancy. So you kind of have to have one to be successfully pregnant, unless you're getting progesterone supplementation. So sometimes, if they're hormonally active, they can block ovulation, but most people, cysts aren't slowing them down. Do they go away on their own? Usually. 75% of simple cysts are gone within 3 weeks. 75% of complex cysts are gone within 3 months. So usually they'll fix themselves. But if it's been lasting a while, and especially if it's one of the more concerning ones, not the simple ones, but endometriomas, dermoids, things like that, you may want to talk to your physician as to whether or not that should be removed. Again, a lot on cysts, a lot to think about. If you're interested in this stuff, let us know. Like, subscribe, follow, post comments saying what else we should talk about. But I hope, if you have cysts, that they've gone away very quickly. And if you know someone who needs help, that they are healed quickly too. But thank you for watching, and like and subscribe, and hopefully we can help you know about more.